I failed NCLEX twice because I memorized lab values the way nursing school taught me, and it's probably why you will too. Look, I'm going to be brutally honest with you. Those lab value charts your professors gave you, the ones you've been highlighting and rewriting for months, they're setting you up to fail. Because here's what nobody tells you about NCLEX. It's not testing if you know that normal sodium is 135 to 145. It's testing if you can recognize when your patient is about to crash, and you have 30 seconds to figure it out. I'm about to show you the lab value memorization technique that helped me pass NCLEX on my third try, and it's been used by over 50,000 nursing students. But first, you need to understand why everything you've been taught is wrong. Your nursing professors give you these massive lab charts, right? Pages and pages of normal ranges. And they tell you to just memorize them. But think about this. When you're taking NCLEX and you see a question about a patient with a potassium of 2.8, you don't have time to remember normal potassium is 3.5 to 5.0, so 2.8 is low, which means no. You need to instantly know 2.8 potassium equals my patient's heart could stop. That's the difference between passing and failing. It's not about memorizing numbers. It's about memorizing what those numbers mean for your patient's survival. So here's how we're going to rewire your brain for NCLEX success. I call this the instant danger method, and I want you to forget everything about normal ranges for a minute. First, the big three death labs. Number 1, potassium below 3 or above 6. Don't think normal is 3.5 to 5.0. Think 3 and 6 are when hearts stop beating. The heart muscle needs potassium to contract. Too low? Weak, irregular heartbeat? Too high? The heart stops mid-beat. Boom. Dead. Number 2, blood sugar below 60 or above 400. Below 60? Brain shuts down. Seizures, coma, death. Above 400? Blood turns to syrup. Organs fail. Also death. Remember, 60 and 400 are the brain death numbers. Number 3, hemoglobin below 7. This is your oxygen carrier. Below 7, your patient is literally suffocating from the inside. Their organs aren't getting oxygen. Critical transfusion time. Now, once you know the death ranges, the normal ranges become obvious. If potassium kills at 3 and 6, normal is safely in the middle, 3.5 to 5.0. The memory palace technique for everything else. For sodium, think of a bag of chips. Chips make you thirsty, right? Normal sodium is 135 to 145. Remember, one bag, 3 to 5 chips. 135 to 145. For platelets, think bleeding. Normal is 150,000 to 400,000. Remember, 150 Band-Aids to 400 Band-Aids. Below 150? Bleeding risk. Above 400? Clotting risk. White blood cells? Think infection fighters. Normal is 5,000 to 10,000. Remember, 5 to 10,000 soldiers fighting infection. Below 5? Can't fight infection. Above 10? Usually means there is an infection. But here's what's really messed up about nursing education. Your professors know this method works better. They know that teaching critical values first, then normal ranges, creates better nurses. They know that memory techniques save more lives than rote memorization. So why don't they teach it this way? Because nursing school isn't designed to make you a great nurse. It's designed to make you pass nursing school. There's a difference. NCLEX doesn't care if you can recite textbook ranges. It cares if you can recognize a medical emergency. And medical emergencies don't come with little arrows pointing to normal or abnormal on your lab report. The nurses who thrive in the real world. We think in terms of, my patient is dying, or my patient is stable. We don't think in terms of slightly elevated or mildly decreased. And that's exactly how NCLEX questions are written. Look, I could keep going for another hour about lab values, but I want to know something from you first. Drop a comment right now and tell me, what lab value has been giving you the most trouble? Is it the coagulation studies, liver enzymes, cardiac markers? Because I'm creating a full masterclass series on this, and I want to make sure I cover what you actually need help with. Also, if this instant danger method just clicked for you, hit that like button and share this with your study group. Because honestly, the nursing students who support each other are the ones who pass NCLEX together. And if you want the complete lab value cheat sheet using this method, the one that covers all 47 values you need to know, there's a link in the description. It's free, and it's exactly what I used to finally pass. Your NCLEX date is coming whether you're ready or not. The question is, are you going to memorize numbers, or are you going to save lives? I'll see you in the next video.